Hello, everybody. We are here today with ProCare Health as our sponsor, and with these wonderful people joining us. We're going to be having a discussion with some new people joining, Marty and also Patty and Janine. They're guests today with our discussion on the Obesity Action Coalition and their upcoming conference called Your Weight Matters, or WYM. So I want to welcome everybody. We're going to let some people in the chat box. They're coming in and saying hi as well. We're going to kind of mention them. Brittany, I'm going to let you do that.
Hi. So actually, you know what? We were going to do a short intro to everyone. So I was going to say when everyone does their intro, if you could go ahead and just mention where you're at or where you're from. We do have a couple people asking where everyone's from. It looks like Mary is from New Orleans, Louisiana, which is one of my favorite places in the world. Um, and GC is from Florida. And yeah, I'm going to do just a quick introduction to myself. I'm really here today. I'm going to be helping answer questions or making sure that our speakers are able to answer questions so they can just focus on speaking and letting you guys know about this awesome conference coming up. So, for those of you who's new, my name is Brittany. We are with ProCare Health. I've been with ProCare for almost a year now, and Brenda and I do put on these weekly live events every Wednesday at 1 p.m. Central Time. Sorry, that is Central Time. So I'll go ahead and pass it over to Janine.
Hi, my name is Janine. I am from Michigan. I am the National Patient Advocate for ProCare Health. And recently I was given the opportunity to be a part of the weekly Facebook Live, actually once a month, to be a part of the weekly Facebook Live. And along with that opportunity came the other opportunity to choose our featured guest for the week. And so this week I was invited, our two guests here, Patty and Marty, to talk with us about the Your Weight Matters conference and the Obesity Action Coalition. And I'm very happy that they accepted the invitation and that they're here with us today.
Happy to be here.
Yes, thank you for
Absolutely.
joining
Thank
us.
you. Thank you.
So let's let Patty, let's let you introduce yourself next.
Okay, I am Patty Neese. I'm chair of the Obesity Action Coalition, and I live outside of Washington, D.C., in Alexandria, Virginia.
Wonderful. And Marty?
And my name is Marty Enochson, and I am the lone Canadian on this panel. I live in Edmonton, Alberta, Canada, and I am a patient advocate who had bariatric surgery 12 years ago and have attended two Your Weight Matters conventions. And I'm here to espouse the excitement about what the conference is and get everybody just absolutely excited about joining in on the virtual show that's going to start next week.
Wonderful, wonderful. Yay. So we're going to do we're going to allow them, our guests, to share a lot more here shortly. But before we kind of get started, because these guys have been at previous conferences, and they're going to show us a little bit about what the conference is about and what you can expect. But before we go into that, for those of you who may be new to this platform and maybe new to basically what Your Weight Matters is, it's a patient-centered conference, a national one that's put on by the OAC, which is Obesity Action Coalition, dedicated to helping thousands, millions of people who are affected by the disease of obesity, and helping empower them in different ways, by education, by resources, all different kinds of things. The OAC is about 70,000 members strong, which is amazing. And basically want to make sure their main goals are basically helping people with, to help prevent weight bias, discrimination against weight, and also those to have effective treatment options available so that they're those things are more prevalent around nationally, around the U.S. and Canada and other places. And when it comes to your health, obesityaction.org is what we're going to be talking about, the website, and also the registration process for this upcoming conference. Now, the conference itself is called Your Weight Matters. So it's put on by OAC. And this year, I think it's really exciting because they actually have a free registration for those who are interested. They have other options as well that have add-ons that you can add on. But I think it's kind of interesting. So anybody can join regardless. It will be held virtually. In the past, there's been some that have been held, in person. And these guys are going to share some of their pictures and experiences from the past conference. So without ado, I'm not going to spend a lot of time talking. I'm going to let these guys kind of talk about their parts with the previous conferences and about this upcoming conference. And then I'll catch up and share some additional things as we kind of go through. So let's start with Patty. Patty, I'm going to let you talk here first. And I'm going to let you actually do a little, there's just so many things that you've been involved in. Tell us a little bit about yourself and your experiences. There's just a bunch we have about you.
Yeah. Thank you. Thank you. I got involved in obesity advocacy work through my obesity medicine specialist. His name is Dr. Scott Kahan, and we have been working together for about a year. And he asked me to attend. There's a group that's based here in DC at the George Washington University School of Public Health called the Stop Obesity Alliance. And he asked me to attend a program there. And just, he said, if you want to talk, go ahead and talk. I'm like, oh, yeah, I'm really reluctant to talk. That's hard for me. And so that's where I started. And I met people there that introduced me to the Obesity Action Coalition. And within about 3 weeks, I think, I was testifying before the Food and Drug Administration about the need for additional science-based treatments for obesity. So, and then it's just gone from there. I do a lot of speaking about weight bias. That is clearly one of OAC's big focuses. We believe that weight bias drives a lot of the policy decisions that are made in this area, and also drives how people with obesity are treated by medical professionals too. I'm sure most of the people in your audience have had bad experiences with medical professionals, so bad that they don't go back and don't seek other treatment or preventative care, that sort of thing. So that's a big focus of ours. But another thing is education, science-based education. There's so much noise out there about what to do about weight. Try this, snake oil will work. Those sorts of things. So we're dedicated to presenting at a patient level, at the level of the everyday person, education about weight and weight management. And that's what the YWM convention is all about. It has its own website at ywmconvention.com. And this is our 10th anniversary of the convention. We've always been in person until last year because of the pandemic. We went virtual. But let me share with you some of the older pictures. And you may or may not recognize at least one person in these pictures. So hang on, let me just share my screen here and find the right one. Okay, wait a minute. Share. Well, it's not letting me share. Let's see. There we go. All right. Can you see my screen now?
Not yet.
All right. Let me try that one more time.
It's okay.
Sorry. It's a new platform for me. Share screen. And I want entire screen. And I want share. Now?
Can you hear me now?
Can you see anything?
Not yet.
Seeing it.
You know what, Patty? Whenever it shows you the options
Yeah.
below that, click onto one of those options. Like you actually have to put your cursor on it and click onto it. See if that helps. I know that sounds really minimal, but sometimes that makes a difference.
Okay, let's try this. Now? I was able to share before, but now I'm not.
No, I don't know.
I don't know either. Okay, so I can just talk too. Let's see.
Brenda, do you have them in your email? Maybe we can share them.
I
No,
don't, but
I'm
she's-
sorry you don't.
Oh, okay.
All right, let me share. Let me see if I can share something else with you. How's
Okay.
that? Let's see if
Is
this
the
will
share
work.
option popping up okay for you, Patty? Is it?
Yes.
It's just not sharing.
All right, let me try this. See if you can see this.
Oh, something popped up.
There it is.
Yes.
Oh,
That's awesome.
This was from last year when we were virtual. And when we'll be virtual again this year. So it starts next, or this Saturday rather. Okay, did I stop sharing now?
Yes.
Yeah.
Okay. And the main sessions are on the 2 weekends, this coming Saturday and Sunday, and then next Saturday and Sunday, 3 hours each of those days, I think it is. And there will be like keynote speakers, and then there'll be breakout sessions that you can attend. And then the last thing is group chat. We're going to open up some rooms just to let people join and talk about what they've just learned about and what they've just heard. So, and to just create community. OAC is perhaps above all a community of people who understand what it's like to be affected with obesity and by obesity. So we're trying to build all that into as much as we can to our virtual schedule. And it's going to be great. I can go over the schedule, but I want to let everybody else talk too. So,
Well, we got plenty of time.
So, Patty, what is your part in this? Tell us what your part is with your Weight Matters conference and with the OAC.
well, I am the volunteer chair of the organization. We have a president and CEO. His name is Joe Naglowski. So he is the professional that runs our organization. And we have a staff. I chair a board of directors, which is all volunteer, and it's a working board. We all work for, this isn't just a lend your name to this organization. It is a do things with OAC sort of board. So we all work very closely together, and it's really the amazing amount of work between the staff and the board that we get done. It is an amazing amount of work. It's amazing what we manage to get done. So I get to sit here and take credit for all that. And that's my biggest role. And so that's my role within OAC now.
Wonderful. Well, let's see.
We got a couple comments coming through.
Yeah, you want to
guys.
read those, Brittany?
Sure. It says, Mary said, I have been to every convention except the very first one.
Right.
So I am committed to attending every year now. That's excellent.
Yep.
Please look into the OAC and the YWM convention and take the opportunity to learn and make friends. Absolutely.
Yeah, it is a great opportunity. And if you you can watch everything live for free on the 2 weekends. If you want to have access to all the videos at any time of the day or night, and if you want to have access to some special events during the week, it's only $50 for all of that, including we have a celebrity chef, Doreen Calandras, who is going to do a cooking demonstration during the week, one evening, and that's through what we call our after hours access. That's one thing. There are other events in the week, during the week between the bookend weekends, that are going to be available to people with after hours access. And if you happen to be a healthcare professional, we do have some CMEs, continuing medical education credits, available for some healthcare professionals.
That's awesome.
Yeah. So we're
It
trying to
looks
hit
like-
a bunch of stuff at once.
It looks like I'm looking at the registration stuff to see how many CE credits.
I thought it was 14 credit union, up to 14, right? Or did I make that up?
It
You would
said
think I would
16
know
here on the
that.
registration. So it looks like close.
You can earn up to 16. I
Oh.
think it may depend on your what profession you're in. Like it might be different for dietitians versus nurses, that sort of thing.
Right.
Because I think the individual accrediting organizations get to pick how much time you can be credited for it. So, but that also speaks to the quality of the education that we provide. And if you want, if I can share the schedule too. Let's see if this works. Chrome tab, here we go. Okay, so this should work. Okay, can you see that?
Yes.
Yep.
You're
Okay.
getting better.
So Saturday, we start with just a welcome, and see, there's always going to be a general session to kick off, and then a break, and then you have your choice between 2 breakout sessions, and they're all about weight and health. Our theme this year is about recharging and change and recharging your health. So that's what it is all these topics are geared to that. And as you can see, here's this post-session group chat. And it's just people joining together in Zoom rooms to be able to talk with one another. One of the things we found out last year is how incredibly active the chat function was, and people wanted more of an opportunity to actually connect. And sometimes when you see these sessions, you want to talk about them with somebody. You have thoughts that you have more questions, you just want to kick them around. So that'll give people a chance to do that. And again, Sunday, we have a general session and 2 breakouts. And it's the same thing for the following weekend. So it will be, it's great education and great connection.
And Patty, one thing that I wanted to mention too is ProCare, which is our sponsor today. They're actually going to be there in the exhibit halls. Brittany's going
Yes.
to be part of that.
I
at
will be there.
one of the
yes.
weekends.
Good.
And so
And thank you
we'll
for
have.
thank you for that.
Oh, no
Yeah.
problem.
I
So
think
for anybody watching, if you want to come visit me at the booth not this weekend,
Right.
but next weekend I'll be there. This weekend, I believe it's Madison.
yeah, Madison will be there. And so, basically, not just ProCare Health vitamins, but all different kinds
Oh, yeah.
of vendors that are
Right.
going to be out there that are going to be talking about their products. If you have questions about all different kinds of bariatric products, which is really cool.
And
Did you have something to say?
our virtual exhibit hall will be open pretty much throughout the weekends.
Oh, wonderful. Wonderful.
Awesome.
I
So, Patty, anything else before we?
I hope you will join us. It is my first convention was in Texas and in San Antonio, and I've been to every convention since. It is, you find the people that understand. And I have found in my own journey around weight and weight management that support is perhaps the most critical thing to find,
Mhm.
the most helpful thing. And the convention is a good way to start finding more of that support.
I just wanted to, it's so hard when we have all five of us here, not to interrupt each other, but I thought really quick before we go on to Marty, I just kind of wanted to do a little bit of a recap for anybody that's just joined us to know what we're talking about. So my name's Janine. I'm the National Patient Advocate for ProCare Health. And today we are talking about the Obesity Action Coalition's Your Weight Matters conference that is going to be starting this weekend. This is a conference that in the past, typically will bring patients together in person, but since the pandemic this last year and this
Right.
year, we've brought the conference, or the OAC is bringing the conference to everybody virtually. So typically once a year, this conference is held at various points in the United States, and patients come together for education and for friendship and gathering, and it's kind of turns into a family pretty much after your first
Right.
after your first conference. I attended the conference myself for the first time in 2018 in Denver, and I've been to each conference since. So I'm thankful that I had learned about the Obesity Action Coalition when I had and became a part of going to the conferences. So I just wanted to just kind of recap where we were for anybody that just came in. And now I would like to introduce us to Marty, my very good friend who I met at the very first conference that I attended with the Obesity Action Coalition, the Your Weight Matters conference. I met Marty. He was here, traveled to Denver from Edmonton, Canada, to attend the conference because you were doing some work with Obesity Coalition in Canada. And from what you had told me during that visit is you wanted to learn more about what was going on here in America and what the OAC was doing because you wanted to take that back to Canada. So you made the trip here just for this conference, and I think you were hooked after that because you've been to each conference too. But so I wanted to introduce you and say how I met you and go on and share Marty. And Marty also went on to chair the European Obesity Coalition, the European Obesity Coalition.
The European Coalition of Patients. I chaired it for about a year, and then I stepped away, and the European group took over, and I also chaired the Canadian Obesity Network, which became Obesity Canada, and I stepped away from that in 2018. But one of the things that I really wanted to do was bring to Canada what I saw Joe and his team at the OAC putting together, which was the Your Weight Matters conference, this amazing conference. And I hadn't been to it until 2018 in Denver, which was my first conference. Patty and Janine have talked about the fact that it's this amazing community of people. And let me tell you, it is a place where I never felt more comfortable with being a person of size in a group of people that are all people of size or have been people of size and understand what it means to live with obesity. The experience was truly the most amazing experience I ever encountered. The best conference that I'd ever attended, from the perspective of involvement and people and the caring and the understanding. And the moment you walked in, you were welcome. You could ride an elevator. You could ride an elevator and meet someone like Patty Neese, who I'm a patient advocate from Canada, and I've spoken around the world. And Patty is a patient advocate from the U.S., and she's spoken around the world. And we'd never met each other, but for heaven's sake, she knew who I was, and I sort of knew who she was. And it's like on the elevator, it's like, "Are you Marty Enixon?" It's like, "How the hell do you know me?" And it's like. It was just this surreal moment where you're in this family. It's like you said, Janine, it's a family of people, and the most amazing experiences that I've ever encountered. I was hooked. I was absolutely hooked, and at that first conference, that was where I was honored by the OAC that year. I was given an award for being a bias buster. The first time, Joe had explained to me the first time that an outsider from not out of the U.S.
Right.
but somebody internationally had received an award from the OAC. So to be honored and to be in a place where it was the most amazing experience. The education was amazing. I couldn't talk enough about it. I came home and I worked hard to pull together our team, and then I left before we had our first event. But they did have their first event, and it was well received in Canada. And my hope is that we will have more like the U.S. version, because it's needed. You need to know, you need to have this place where you can come, you can hear what the latest information is, the scientific information, not the snake oil information, not this person or that group or that is going to just pass you off and try to take your money. This is information that you will walk away with, and you will be able to do good things to help your battle with obesity. As simple as that.
Marty.
And we actually have this year, some of our speakers have sort of calls to action for, and that happens every year. And there are things for you to take away and think about how you're going to apply in your life and in your circumstances. So we hope, by the way, we hope to be back live next year and in Henderson, which is outside of Las Vegas, Nevada.
Ooh.
Marty,
So
I've been waiting for 3 years for Las Vegas. Gracious me.
Marty, I brought with us today a photo of you and me from the first time we met in 2018 in Denver at the Your Weight Matters conference. That's also the same time that I met Patty in person,
Right.
But Patty and I knew each other through Twitter, through our advocacy
Right.
work. So we were already planning to meet up once we got to the conference. But there's a picture there Brenda has to share of us.
Yeah, and Janine, before I do that, I'm going to have you. We've had a couple people say something about the volume. Would you want to turn your volume just a tiny bit up, just see if that maybe? We had her turn her volume down because she was hearing an echo. Okay, I'm hopeful.
Is that better?
Okay.
Better.
I think it's okay, but it's just not quite as loud. Not
Some
quite
people have
as.
a hard time hearing me.
Yeah.
Use your mother voice.
Just try to talk louder, I guess.
Okay.
If we can't figure it out here, but I will let me share my screen and I'll let you kind of share about these slides that I'm sharing. How does that sound?
Okay, so
Okay.
am I a little bit louder? Oh, she said I'm not getting louder. Yeah, it's
No,
almost
you're
the same
not.
compared to everyone.
Mm-mm.
Oh, I wonder what happened.
I mean, I can hear
Okay,
you.
is
You're
this-
just a little bit quieter than everyone else.
Is this better? Do I sound better now, guys?
I think she sounds a little louder, maybe a
A
little bit.
little bit louder. Yeah.
Yeah.
A little bit louder? Okay, I'm sorry, I can talk.
When we
louder.
have you on, we'll just turn it up just a little bit. So,
so I'm
so
sorry.
Janine, I'm going to share my screen here. We have Janine. Janine, while I'm getting ready, while I'm preparing to do that, why don't you tell us a little bit about you and your participation with all this and all this?
Okay, so again, my name's Janine. I'm from Michigan. And back in 2017, before I had bariatric surgery, was speaking with my surgeon, and I had shared with him that I wanted to use my story on social media, that I wanted to share what I had gone through, my struggle with obesity, which started when I had began taking infertility medications, and I had done that for 5 years. And during that time, I had a roller coaster of weight issues from all of the medications, and I got to a certain point where I just wasn't losing weight. Okay, so long story short, I had gained weight through my infertility struggles, and then with that, comes depression and everything else that comes with being of obese size. And I went to talk to the surgeon about bariatric surgery. And during that, I decided I was going to share my story publicly as I lived it through this surgery and share this to help inspire others. And that I felt that there was a bias and a stigma that surrounded obesity and surrounded those affected by obesity. And I wanted to change that. So I'm sharing this with my surgeon, and he then directed me to the Obesity Action Coalition and said this would be a great place for you to start to learn more and to be able to share. So from there, I just kind of took things to social media. I was on Twitter. I was doing different things, just trying to advocate for patients and myself and to share what I was experiencing with having the surgery. Throughout that time, I met Patty on Twitter, and I learned more about the Your Weight Matters conference, and I decided that I was going to go. I traveled to the conference by myself, knowing nobody in person, just a few people I had met on social media. As soon as I was there the very first day, I was attending a lunch. Everyone met at our hotel had a restaurant, and there was just a lot of people that just showed up there to eat. And I was sitting at a table ordering all by myself. And a person walked up to me, a nice, wonderful lady, Nikki. Some of you might have heard of her. She was the bariatric foodie. Well, she walked up to me and said, "I see you're here by yourself. Would you like to sit at our table?" And from right there, it was like I was pulled into this community of people that just wanted to befriend me. And I was there alone, and I no longer was there alone because I, throughout those few days, just kept meeting more and more amazing people who were out there advocating and had the same thoughts and hopes as me. This conference led me to ProCare Health and to talk. The owner of the company actually was at the conference, and I had spoke with him and asked him if we could do some work together advocating. And this was just after I had created the hashtag I am a bariatric patient, and I was trying to get the hashtag trending, and I explained to him my goals. And he said, let's do this. Let's work on a way to advocate together. I'd love to see you on our team. And from there, that relationship started, and then so many more. So here I am meeting Marty at the conference in 2018. And we're also there with Pam Davis, who's a friend of mine, who is a big part of OAC herself, and she is an RN. So she is an amazing advocate also. And I don't know, you can click on the next picture. So, and everybody gets a shirt, as you can see. Everybody gets a shirt that talks about the conference. So the middle picture there is me meeting Patty for the first time, and in person, but we knew each other through social media.
I remember that hat.
Yeah. I still have that hat, and I love that hat.
Yep.
And there's another picture of Marty and I and a friend that he brought from Canada with him. And then the next year, 2019, there's a conference picture of me with in the blue shirt for the 2019 conference in Tampa. So I wanted to just share.
That's Dana there.
Yeah, that's Dana.
Right.
But I didn't know if I should say her name or not. But
Oh, okay.
She'd be happy for you to say her name.
She'd be happy. Absolutely.
Right.
She was wonderful, and we had a great time meeting and discussing and talking about advocacy work too. So it's kind of my story. What other pictures do I have there? Oh, there we are again.
One
Patty.
more.
But this was in Las Vegas though, Patty, when we met
Right.
for the
At Obesity Week,
at
wasn't
Obesity
it?
Week, yes.
Yeah.
So this was at Obesity Week, and our little bit of time we had there together, because we didn't get to spend too much time because we were so busy in sessions and learning classes and scientific sessions for this conference. It was just really intense, but I certainly came home with a lot more knowledge to bring to everybody. So I appreciate all that. So yes, my story began with Your Weight Matters, actually. So that's how everything began for me, because I attended that first conference, and from there met these amazing people, but I also met ProCare Health, and which has given me this opportunity now to be the National Patient Advocate, and which has given me loads of opportunities for travel and to be on Capitol Hill. I've been on Capitol Hill a couple times advocating for for Treat and Reduce Obesity Act that we're trying to pass on the Medicare side. So this has been wonderful for me, and OAC is in my heart, and so is this conference, and anyone can message me anything about the conference if you're thinking about going, because this is just definitely a conference to attend. So thank you.
You know, and one thing with that I didn't mention about the convention is that what happened last year, you know, it was our first time doing this virtually. We had people from over 54 countries join us. So it got international attention. We had a couple thousand people that joined us for that event. This year, people aren't quite as stuck at home with their computers. So we'll see how that has an impact. But what we found happened is that some people registered for the free, just registered and came to a live session or two and listened to those and watched them. And they liked it so much they didn't want to miss any of it. So they then registered for the after hours access, which you can add on after at any point when you've registered for the free, if you've done the free registration. So that's an option too. You know, come check it out. And if it looks like something that would be helpful to you, do it that way. And then you can watch, then you're, you know, if you're busy on one of these Saturdays or Sundays, you can watch the presentations anytime
Patty,
you want.
I'm going to share my screen, and I'm going to actually go to, we're going to share the link here in just a moment, but I'm going to go to the Your Weight Matters conference page.
Right.
Let me copy that, and then I'll paste it in we can paste it in both our Facebook page and our Crowdcast.
Chat.
Yeah.
We
So
actually had
basically,
a couple comments too that I wanted to read
yeah,
out loud
please
in
do.
case. Well, just because if people are watching us on Facebook, they don't have access to these comments on Crowdcast. And Mary had a really good point that I think would be beneficial to know if you're thinking about joining this this convention. So she said something that attracts me to this convention is that the information provided by professionals is presented in a language that's easily understandable to all people. You don't need a degree to understand it. I think we've all been to at least one conference or convention, and it's been kind of hard to understand and follow what they're saying, but this one is not the case. So I just wanted to say that in case, because I think, you know, some people might have that concern. So
that is go ahead,
Go
Marty.
ahead. I was going to say that I couldn't concur with you more. It's like working in the legal field where I work. Legalese is like medicalese, and you know, they keep it so toned down to a lay person. A lay person can go in and understand what's being said, and they walk away with information that they can then put into action, and not wonder, well, what is that medical legal term that they're talking about? I don't know what that means. You actually walk away learning stuff and having an understanding of what they meant.
Yeah, that's absolutely right. And some of these people are leading scientists often in the field, and they do these high level talks that for me would go zoop, zoop, right over my head. I'd never be able to, you know, you give me statistics and I'm like, unless it's like just a bar chart or a pie chart, once you get much beyond that, I'm done. But they bring it all down to a level. They basically are simplifying what they know, which is great. It's still the same content in the sense that of what they're doing in their scientific presentations, but they're presenting in a way that you and I can understand it.
Yes.
Love that.
Yeah. One thing I wanted to, so I got this pulled up right here.
Right.
With our registration options, just so that everybody can kind of see when they go to the registration page, which I'm going to copy that here. Again, when they go to this registration page, they'll have the free event registration, they'll have the full event, and then they'll have the CEU registration. So basically, I'd say the difference is what I was seeing, and maybe Patty and Marty and Janine can kind of chime in if they have anything else, is the big differences was for the free event, you have access to many things. And then in your full registration, it looks like you have real sessions in real time plus after hours access to recorded sessions. That looks like the biggest thing. And then the CEUs, you actually can earn the 16 CEU credit hours. Would that be what you would say is the differences?
Yeah, the big thing is being able to access it when you're ready to access it. That's one of the big things. There's also there will be a couple social events this year. Last year we put the virtual together pretty quickly because the pandemic came upon us pretty quickly. But we've added some social events like Friday night and this is with the full event registration. We're going to have different breakout rooms and they're all going to be themed.
Yes.
So you can go to different rooms and you know, I don't think I'd be spilling the beans if I said at least one will be about your pets. So, you know, they're just fun things.
One's a party room where you're going to be able to do Zumba online because that's where I'll be.
Good for you. Good for you.
Yes.
Yeah. I mean, it's so there are things like that, but really the biggest thing is it's being able to watch whenever you can. And not have to actually be there at those days and times on those weekends when it will be scheduled, when it will be shown broadcast live.
Yes.
I also noticed that there was an option too, that when you're doing the registration process, that you can donate to the OAC in order to, and then you get a free bag along with that.
Yeah, Brenda, I sent you my PowerPoint with those pictures.
Mm-hmm.
In your email. Is there any chance you can pull that up because I can show you?
Absolutely.
And there's actually there's definitely a picture of Marty everybody needs to see. In there.
Oh, we gotta open this up.
And it'll give you an idea of sort of, you know, the fun we have and the approach and everyone is welcome. You know, all these things are just really important to us. But the one is from a social event.
Okay, let me share my screen.
Well,
we got to see these. The anticipation is building.
It's the social event of the conference. Let me tell you.
So this is Tampa again, and one of our speakers on the shot of two of us is me with my obesity medicine specialist, Scott Kahan, who is one of our program directors, along with Dr. Bob Kushner from Northwestern. And they developed the program, the scientific pieces and educational pieces of the program. One of the people that's always presented is on the far right in the other, the gentleman with his arm around me, is Dr. Paul Davidson. He is fabulous. He's a psychologist. Yes. He is wonderful. His wife, who's on the other side of me, is also fabulous and is a psychologist. And then their daughter, Rachel, was with them. So it was a family affair that year for them. But Dr. Davidson will be presenting again this year. So he's been a real favorite. Amazing. Yeah, he's amazing.
We actually had his wife on, we had his wife on a Facebook Live here recently talking about her experience with bariatric surgery and how it helped her with reflux. We can post the link to that too in a moment.
Yeah, Susan's wonderful.
She is amazing as well. Oh my goodness gracious me. The whole family.
Right. Okay, we can go to the next one.
Okay.
And while you're pulling that up, I'll go ahead and post the link for anyone that's interested in that live event that Brenda was just talking about.
So this is just, we have a diverse group of people and we have other Canadians that join us. The picture on the top is two other friends, Ian and Lisa from Canada, this was in Tampa again, I'm pretty sure. And I don't know where Amber and I don't know where this other picture came from, but again, leaders within the organization, it's a great time to get together. Great time. Okay, the next one is the fun one.
Oh, here we go.
So
Oh, my
this
goodness.
was in New Orleans. And let me introduce you on the right to Peaches. Peaches Enixon,
That was
in case you
don't
can't
you
tell.
don't you just love that hat? Oh my goodness.
Yes, you were the star of the show and you left feathers everywhere.
Oh my
I molted throughout that entire ballroom, let me
Yes,
tell
you
you.
did.
But
You
let
did.
me tell you, Patty, about that event. That event, because both events, both times in the live conferences, that event, I remember the first time I went, I didn't dress up the first time, and I just thought, who's going to dress up? Like, who is going to feel comfortable being a person of size that's going to dress up? And I walked into the room while I walked down the escalator, and I was like shocked. The first year in 2018 in Denver, the theme was the great outdoors, and I could not believe the costumes. I was definitely in the minority, and I mean the great minority. There were more people dressed in costume. I was blown away. And so I made sure that the next year I was not coming without a costume. And you are so incredibly welcomed, and you are made to feel so comfortable, and just be yourself.
Right.
And oh my gosh,
Right.
it is one of the highlights of the conference. The education, the camaraderie, the people, but this event is just like, it is top notch. I can't talk enough about it because it was so much fun, and it was just such an amazing time to be with people that are like-minded and care about you. It's like you said, Janine. You walk in and you're not alone. You're not alone at all. You are welcomed and you are embraced. And I have more Facebook friends because of the conference that I met,
Sure.
and we still stay in touch. We check in on each other. We support each other. Literally around the world, because that in Tampa, that conference in Tampa, there were a number of out of country people, not just Canadians,
Right.
but there were Germans there, there were English people there were Norwegians there. There were so many international people there doing work and advocating and sharing and learning, and it was just an amazing experience. I can't talk more highly about the Your Weight Matters convention.
And you had mentioned, Brenda, you mentioned donations. The picture on the left of that with where we're wearing these fleeces, those were our gift to people who donated to our we have a scholarship fund for the convention, because not all of our members and not all the people that want to attend could afford to do it. I mean, now that we're virtual, it's different, but we're going to go back to that again. Hopefully next year we'll be in person, and we'll need people to donate money so that other people who can't otherwise afford it can experience this event, can join and experience it.
So thank you for telling us what that's about, because people, being able to share that experience with other people who can't always do it is a wonderful thing.
Right. That's right.
Can I be heard better now? Am I heard
I can hear you.
Now? Okay. Well, what I wanted to say is to tag on to what Patty said. So the scholarship fund is there for participants to apply for, to help cover the costs. And the conference itself is really inexpensive. It was like $99 when I went. But so that's the registration for the in-person, not the virtual, which is free. But it was like $99. However, from there, people did have airfare and hotel. So things kind of added up. So even though the conference itself was, not that much.
Right. It's getting there and staying there and some people only need some help, which actually stretches our scholarship fund out to cover more people. Like, some people may be able to cover the hotel, but not the airfare to get there, that sort of thing. So,
and participants will pull up too into rooms. So if
Right.
Puts a word
That's
out
right,
there
too.
that they're looking to share a room, and someone else knows someone who's looking to share a room, that people get put together too. So that helps. But
I think Marty and I need to share a room next time we're together so he can teach me how
Oh,
to be Peaches.
so you can see as fabulous as
Fashion
I was.
advice.
Indeed.
That's right.
Guys, we just have a few minutes. If we keep it under an hour, we're able to post onto other social media forums if
Oh.
it's below an hour, and we're almost there. Two things that I wanted to make sure that we mentioned before we stop. First of all, how can people be amongst the first to know the latest information on this year's conference? There is an e-news alert, from what I understand, during the registration process. Should we talk about that at all?
Well, we're so close to the conference now that if you just register for it, you will be getting pretty much everything that the e-news alerts would have
Okay.
had.
okay.
So at this point, that I'd say just, as I said, register for the free, check it out. And if you want to convert to the full
Okay.
access.
Yes.
And then the second question I have is let's see. Okay. Is there a date and location? We talked about this earlier for the Your Weight Matters 2022 conference. Repeat that information for us.
Yes. Oh, good Lord. The date, July. It's in,
I actually have it pulled up.
I'm sorry.
It's,
I'm so focused on this one. It's in Henderson, which is outside of Las Vegas, Nevada.
I think it's July 14. I think I remember seeing July
that sounds
14.
right. That sounds
July
right.
14th through the 16th.
Yeah.
Okay.
Right.
Oh, I am usually a volunteer. And so I am one of the volunteers. I am the Welcome Committee. I have been graciously invited to be a member of the Welcome Committee, and I did that. That was my first time in Tampa, and it was absolutely amazing. You get to meet everybody. You literally get to meet everybody because you're welcoming every single person that comes in to the facility, and you're making them feel welcome. You are welcomed the moment you walk into the building, and you are not made to feel anything less than welcome, and you will walk out of there when it's over saying that was the best freaking place I've ever been to. That conference was so amazing. Yes.
And the conference site for our next live in-person conference, the one in Nevada, it's a fairly small hotel as hotels go. Some of them have vast complexes, but we'll take over a lot of it. So,
Yes.
which will be really cool. It'll be really cool. So
I'm looking forward to it.
Nothing but like a bunch of queens taking control of a hotel and running
right.
the show. Oh my God, it's going to be amazing.
That's right.
Oh, Mary has something else to say too. Brittany, you want to read that?
She loves Peaches. She loves the costume. But she actually did. I know, I'm sad I didn't get to meet Peaches.
Well, there's always next time.
I hope I can go. I might have to fight over who gets to go, because there's a lot more employees now, and I don't know if he'll be able to send everybody, but I hope I can go. But she actually did have a good point. She said, always sharing a room, that does really cut down on the cost. She's done the share a room a few times, and it really does help. And she said that you guys are a great group, which I can tell that already. I've been laughing most of this time with you guys. You guys are so fun.
Well, I'm so, I have so much admiration for Janine and Marty and all their advocacy work in this field. The convention is just a tip of the iceberg. Mm-hmm. It's just the tip of the iceberg. Another big OAC initiative right now is the Stop Weight Bias campaign. You can go to stopweightbias.com, hear other people's stories about what they've experienced. I think a lot of you would probably be able to relate to it.
Yeah.
I think it helps to know you're not alone.
Yeah.
I think that's the best part, is knowing that you're not alone. You walk away at any point when you get involved with the OAC. You don't have to be, obviously you don't have to be from the US to be involved in the OAC. I'm in Canada, and I've been involved in so many
Oh, right,
factions
right.
of the OAC and the Your Weight Matters convention. It's like all they do is call. They say, Marty, send me an email, and will you do this? Absolutely, because I believe in what we're doing. I believe in what the OAC is doing. I believe in what Patty is doing. I believe in what Janine is doing, and what you young ladies are doing. You are bringing the information out so that everybody can hear. That's why we speak up. We speak up because we want to make a difference. And if we can make a difference, I've always said whenever I've spoken, if we can change just one person at a time, if necessary, just one person at a time,
Right.
then we've done something good. If we can make them look at what it means to be an obese individual from a different perspective, and see where we come from, then we've done good. And that's what this conference does. This conference allows people to feel confident about themselves and to feel like they're making a difference.
Right.
Absolutely.
And thank
there's
you to
another comment.
ProCare.
Oh, thank you. Thank you so much,
Yes.
Patty. Well, I mean, we love being a part of this. We love being able to offer things to help people too as well. It looks like Mary says you don't have to be a weight loss patient either. We are all affected by the disease of obesity, and that is so true.
That's
It
right.
is.
And a lot of our attendees are post-bariatric surgery patients, some pre, and some are people like me who have not had bariatric surgery. So it doesn't matter. It does not matter.
Well, one of the things that I've always said in all of my presentations is, Mary hit the nail on the head in that we all know somebody,
Right.
our mom, our dad, our aunt, an uncle, a grandma, a grandpa, someone, a friend, a
Yes.
coworker. We are all affected by obesity, but yet we are the one group of people that are beat down repeatedly all the time, and we need to change that. So, yeah.
I know
Thank you,
Brenda
Marty.
has to close this up, but Patty, maybe in the future we would be able to bring you and your obesity medicine specialist on for an interview in the future. I would love
We
that.
would love to do that.
Yeah.
If
And
I,
know Dr. Khan,
just let me know.
so, yeah.
He has a tighter schedule than me. I'm just saying.
I know him too, so I think he would do that for us. And the work that the two of you have already done together, I think that really would be great to share with our viewers. So I know Brenda has to close this. Thank you.
That's okay. You know what? We have less than a minute. Anybody have any closing points that they want to say or mention before we do? Thank you, Janine, for bringing that up.
Thank you.
And
Thank
thank you for you guys and joining us today. It really means a lot to us.
It's a pleasure, and it was such a good excuse to see Janina and Marty.
Yes, it's been too
Brenda,
long.
Brittany.
So long.
Yes,
Brenda and Brittany,
And
thank
thank
you
you
for
to all our
facilitating
listeners.
this.
Of course.
Thank you, Janine.
yes, absolutely.
Yes.
Yes.
Gwen says OAC is where I met you. Gwen says that. Oh,
Yes.
wonderful. Thank you, Gwen. We probably all of us, I'm ready to get back out there and be at
Yeah.
these conferences because it is, but virtually at least until then. So
Yes.
Right.
thank you, everybody. And
Goodbye,
if there-
everyone from Canada.
Thank you.
Bye,
Thank
everyone.
you.
Can we stay on and stop